first, live, local. This is Fox 12 Now.
Hello everyone, this is Fox 12 Now. I'm Greg Dibbler. As always, we appreciate you joining us. We are live streaming here out of the Fox 12 Oregon newsroom as we do every weekday starting around 1 p.m. You can find all of our segments on our YouTube channel at kptv.com and of course on the Fox 12 Oregon apps. And we cover a wide range of topics here. We get to have a little bit of longer conversations and more in-depth discussions. And one we're talking about today is something coming from the Oregon Health Authority. It's a new initiative called Oregon Health Forward. The idea is to help remove some of the inequities that may be in the healthcare system when it comes to certain people. And there's a lot more than that as well that goes with this. And to talk about this, to get into it, I talked to Dr. Sejal Hathi, who is the director of the Oregon Health Authority. And she walked through how this initiative works, what it's going to involve, and what it really means for citizens of the state, and maybe even a template for people beyond the state of Oregon across the United States. So we get into quite a bit here in this talk, so I'm going to go ahead and play it for you right now. Right. Well, Doctor, thank you very much for having some time to join us here today to talk about this and this announcement coming from Oregon Health Authority in conjunction with everything else that you're doing. But to give everybody, a little bit of context on this, can you talk about what Oregon Health Forward is and just a general understanding of what that initiative means?
Of course, and thanks so much for having me. So Oregon Health Forward is a new statewide mobilization that will empower our agency, Oregon Health Authority, to achieve our goal to eliminate health inequities by 2030. Oregon Health Forward comprises three parts. The first is our strategic plan, which we published earlier this year to outline a clear roadmap with actionable targets for how we will achieve this ambitious goal. The second is our call to action, which is a statewide initiative we are leading in partnership with the National CDC Foundation to mobilize commitments from new and existing partners across the state that advance our mission of achieving health equity. And the third prong is this transparency, accountability, and belonging initiative, which is an organized internal effort to strengthen our capacity to deliver on our commitments consistently and transparently. And together, all three of these initiatives will accelerate our quest to eliminate health inequities and better prepare us for the future.
When you talk about the health inequities side of things, when you look at the state of Oregon, what are some of the biggest glaring issues there when it comes to that?
Yeah, so health inequities are unfair barriers to good health, including lack of access to health coverage, lack of clean air and water, the relative expense of housing across the state. Often they are social, political, and economic forces beyond the purview of traditional healthcare that nonetheless create and perpetuate poor health outcomes, higher healthcare costs, and increased health mortality.
And talking about, this is obviously a bold initiative here to tackle all of this. One thing that can happen with these is, interoperability between different organizations. You mentioned the CDC's involved, and this is this is a big initiative. This is a lot of probably people that are involved in this in organizations. So when it comes to that side of things, how is that going to work as far as working with other partner organizations?
So we are grateful to have the CDC Foundation support. We will be reaching out to public and private sector organizations of all sizes across all sectors, by which I mean civil society, academia, business, philanthropy, in and out of traditional healthcare, to mount commitments leveraging their unique resources and capabilities that will advance shared progress toward our health equity vision. And we're doing this because, again, we recognize that these are inequities born of forces far outside our traditional purview. They demand creative alliances. They require whole of society action. And the call to action is our response to this challenge in recognition that we can't do this alone. OHA cannot, state government cannot. It requires all of us rolling up our sleeves, getting into the arena, and recognizing and exercising our shared responsibility to produce a future where every Oregonian can thrive.
Something where each organization is probably bringing their best to the table or what they specialize in and then contributing that for everybody else.
Exactly. These commitments can range from bold philanthropic contributions and in-kind donations, including donated staff time, technical expertise, and education, to new products and service line expansions, institutional and systems level policy changes. It really runs the gamut, but it's about looking at what an organization can uniquely do in their industry to advance shared prosperity and health equity and bringing that to the table.
And when it comes to the funding side of something like this, is this something where each organization is working within their existing budgets? Is there additional funding that would be available, maybe from a federal level or state level?
So we do expect each organization to tap their existing resources, and proposed commitments are to be evaluated in the context of a committing organization's overall scope and size. That said, if we expect more grassroots organizations mount commitments that for scale or for sustainability could merit from supplemental funding. The CDC Foundation has also offered at their discretion to leverage their philanthropic network to fundraise for and support those proposed commitments.
Is there anything like this that's happening in another state across the United States?
So the call to action here in Oregon would be the very first partnership and initiative of its kind. It is a model that we and the CDC Foundation are hoping to set for the rest of the country for how to tackle these thorny cross-sectoral issues like health equity. And so we're hoping that we set a precedent that other states can emulate and follow in this next year.
So when you're talking about health inequities and what those are, what that means to citizens of Oregon and elsewhere, can you explain what that is and how that's affecting the healthcare of people?
Appreciate the question. So health inequities are unfair barriers to good health that cause differences in health outcomes between groups of people. They're often caused by social, political, and economic forces far beyond the purview of traditional healthcare, but could include the fact of poverty itself, housing insecurity, food insecurity, lack of access to clean air and water, all of these broader drivers of poor health that are not the fault necessarily of the individual, but rather the product of structural, policy, institutional forces and choices that make it harder for people to live a healthy life.
For everyone out there, what's the best way for them to follow along with this initiative as far as what the next steps are and what the organization is doing?
So we invite all the public and prospective partners to visit our website at www.oregon.gov/Oregon Health Forward, where they can learn more about and read our strategic plan. They can learn more about the nearly 24 projects that comprise our Transparency, Accountability, and Belonging initiative. And they can see the types of commitments that we're looking for in the call to action and potentially make a commitment of their own. So it's oregon.gov/Oregon Health Forward, and we invite any and all input, ideas, and contributions.
Fantastic. Well, Doctor, thank you so much for having some time with us.
Thank you.
All right. So again, we appreciate the doctor and the director there of the OHA for having some time to discuss this with us. And if you have questions about this, feel free to send us an email, fox12now@kptv.com. We can see if we can get some answers for you. But obviously, this is a very, very far-reaching, big initiative, as she mentioned, the first of its kind in the country. So looking forward to seeing how that works out and where it goes from here as it evolves over the coming years. If you would like, as I mentioned, that email address, if you have something that you would like us to cover, that maybe you'd like a deeper dive on or more information on, feel free to send us an email, because that's something that we might be able to do here for Fox 12 Now. We can have longer conversations, deeper dives, things along those lines. So we appreciate you joining us. You can find all of our segments on the Fox 12 Oregon YouTube channel, kptv.com, or of course on the Fox 12 Oregon apps on whatever platform you are on. We are live here from the newsroom. So the things you see happening behind me, this is a newsroom. Things are going on. People are working. So that's part of the backdrop of what we are doing here. But we have more coming up this afternoon at 2 o'clock. We've got the Fox 12 Weather Podcast, a video edition. You don't want to miss that. So again, come right back to whatever platform you are on, and I will talk to you then. I'm Greg Nibbler. This is Fox 12 Now.